Good afternoon, everyone. My name is Ezeude. I'm a PGY2 Health System Pharmacy Administration and Leadership resident here at AdventHealth Orlando. Today, I will be presenting a CE with an administrative focus as a part of the pharmacotherapy ground rounds. Neither myself nor my advisors have any financial disclosures with respect to this presentation. This CE is brought to you through the University of Florida College of Pharmacy and is accredited by the Accreditation Council of Pharmacy Education. These are the regularly scheduled objectives for this pharmacotherapy ground round series. Today, I will be presenting on a diversity and inclusion topic entitled Systemic Racism, Uncovering Bias Within. The specific objectives for this presentation are as follows. By the end of this presentation, you should be able to summarize systemic racism within the United States, identify manifestations of bias within the workplace, understand the relevance of diversity and inclusion initiatives, and discuss practical steps towards improving diversity and inclusion here at AdventHealth and within the profession of pharmacy at large. Before beginning this presentation, I would like to set some ground rules. The topic and contents of this presentation are sensitive and uncomfortable. I want to encourage everyone to acknowledge their discomfort and vulnerabilities throughout this presentation. Additionally, disagreement with any of the concepts or ideas shared within this presentation should not stop us from listening and being respectful of one another within this safe space. Lastly, as with any diversity, equity, and inclusion topic, I encourage everyone to be open-minded. And with that, let's begin. I will start this presentation by providing some background on systemic racism and its modern-day implications. I will then shift gears and talk about diversity and inclusion in the workplace. We will then discuss and unpack concepts such as privilege and bias. And then finally, I will couch the presentation by providing practical tools to uncovering bias within, as well as next steps towards improving diversity and inclusion, both as individuals and as an organization. Let's start with some background. The institution of slavery dates as far back as 1619 with the arrival of Africans to the American colonies. Africans were stripped of their human rights and enslaved as chattel, an enslavement that lasted more than 2 centuries. At the time, scientists proved that Blacks were a less evolved subspecies of the human race. As such, Black bodies continued to feed the engine of the US economy, particularly following the advent of the cotton gin in 1793. The many years following that, raw cotton was almost exclusively grown by enslaved persons. In fact, a census taken in 1860 revealed that enslaved people represented one of the largest US commodities, valued at $3 billion in 1860 currency, which in 2020 dollars would be equivalent to roughly $95 billion. From the arrival of Black bodies to the Americas through to about the mid-19th century, America's westward expansion, along with a growing anti-slavery movement in the North, provoked a national debate over slavery. And this helped to precipitate the American Civil War, from 1861 to 1865, which brings us to the second timestamp on our timeline. The war was fueled by clashing economic interests, cultural values, slavery, and the power of the federal government over states. Notably, within the third year of the bloody Civil War, we saw the emergence of the Emancipation Proclamation, which declared all slaves free. By the end of the gruesome war, we see the passing of the 13th Amendment in 1865, thus abolishing slavery and involuntary servitude. Following the turbulent era of the Civil War is the Reconstruction period, defined from 1865 to 1877, bringing us to the third stop on our timeline. This period was marked by efforts to reintegrate the Southern Confederate States into the US, as well as newly freed slaves. This was largely reversed and stalled by the violent backlash of the anti-Black racist group, the Ku Klux Klan, who were radically bent on restoring white supremacy in the South. By the 1870s, the group had branches in almost every Southern state. Law enforcement officers and everyday civilians were unwilling to testify against them. Within our last stop on our timeline from 1877 to 1968, we see the end of the Reconstruction period and the birth of Jim Crow laws in 1881, which segregated Blacks with whites, positing separate but equal. This era was also marked by key Supreme Court cases such as Plessy versus Ferguson in 1892, which constitutionally upheld racial segregation. And then Brown v. Board of Education in 1954 seemingly ruled against Plessy by finding segregation of public schools unconstitutional per the 14th Amendment, which kickstarted the civil rights movement and pushed for justice and equality amongst African Americans. The era ended, unfortunately, with the assassination of Martin Luther King Jr. While that succinctly summarizes the plight of African Americans in the first 3 centuries of America's history, it is important to highlight how slavery impacted and catered to healthcare as an industry at that time. Southern medicine of the 18th and early 19th centuries was harsh, ineffective, and experimental by nature. Physicians were active participants in the exploitation of African American bodies. Records revealed that slaves were both medically neglected and abused because they were powerless and legally invisible. The courts were almost completely uninterested in the safety and health rights of the enslaved. This is seen in a number of case examples throughout history, such as in 1845, the father of modern gynecology, Dr. Sims, performed numerous surgical reproductive procedures on African American women without anesthesia. Also in the 1930s, we see the federal government support the coerced sterilization of over 5,000 African American women. Within that same decade, we see the infamous Tuskegee syphilis study, which I will talk about in greater detail in a future slide. And also, all of these are ways in which healthcare has benefited off of the backs of African Americans from slavery through today. And they have sustained and developed what we know today. Given all of this history, it is clear how slavery's horrific past and the subjugation of African Americans to an inferior second-class position in society serves as the underpinnings for modern-day health and social injustices. The medical exploitation and experimentation that was experienced in the 18th, 19th, and 20th centuries have left indelible marks on the psyche of African Americans, thus fueling their current mistrust of our healthcare system. The notoriously horrid living conditions of African slaves over time became the bedrock from which many worsening health conditions among African Americans today have stemmed. Also, the silenced political voice of African Americans that they experienced, along with the passing of notable laws like the 3/5 Compromise, culminated in the modern day feeling of possessing limited political power and a sense of reduced self-worth. These notions over time have systematically curated a long-standing culture of neglect, inattention, and dismissal of the Black narrative and experiences, all of which continues to worsen the equity and equality gaps between African Americans and other minority groups. The magnitude of such gaps are captured in the higher burden of illness, injury, disability, and mortality experienced by African Americans relative to Caucasian Americans. For example, African American infants are 2 to 3 times more likely to die from perinatal conditions, sudden infant death syndrome, unintentional pneumonia over their white counterparts. Roughly 13% of African American children have asthma compared to the less than 8% of non-Hispanic white children. The disparity in access to mental health services is even more alarming, with only 8% of African Americans having access compared to greater than 18% of their white counterparts. Finally, with COVID-19 case fatality rates, they disproportionately affect African American and Latino communities, with African Americans being twice as likely to die from SARS-CoV-2 compared to their Caucasian counterparts. As you can see from the overview and context provided so far, the concept of systemic racism becomes crucial to understand, to digest in order to uncover hidden bias. Ultimately, this needs to be unpacked in order to appropriately devise diversity and inclusion strategies. Racism, which has largely been discussed on an individual level, actually has 3 distinct forms. It's visualized perfectly in the upper right corner of this slide. And as you can see, racism can be internalized on the individual level, it can be interpersonal between how two individuals interact, and it can also be institutionalized, which is also known as systemic. While individuals often reject the idea of being personally racist, it is important to note that you and the systems involved can directly and indirectly push racist and discriminatory agendas forward. Formally, systemic or institutionalized racism is the macro level systems, social forces, institutions, ideologies, and processes that interact with one another to generate and reinforce inequities among racial and ethnic groups. Examples of such systems and structures are our education system, our healthcare system, our judicial system, our criminal justice system, and our policing systems. The takeaway message here is that contrary to racism being on an individual level, systemic racism looks at a larger structural and institutional operation rather than individual biases and behaviors. The very institutions that make up the way we live, how we've structured society, how we come to make certain decisions, how we decide what's fair and what's just, is essentially the framework upon which systemic racism can show itself. Due to systemic racism and how vastly it permeates all facets of our society, conscious and unconscious ideas of white superiority and entitlement are often widespread and go unconfronted. As mentioned, our policing and criminal justice systems are examples of macro level structures where systemic racism can manifest. We see this with the Black Lives Matter movement against the unlawful killings and brutalizations of Black bodies by the police. This year has been notable for the Black Lives Matter movement with the killings of several individuals, such as Ms. Breonna Taylor, who is a 26-year-old woman, shot in her home while sleeping by plainclothes Louisville officers that arrived to her apartment with a search warrant, though having entered the wrong apartment. Ahmaud Arbery is a 25-year-old male who was shot outside of his home while jogging by police officers. George Floyd, whose is probably the most publicized of them all, is a 46-year-old male who was arrested, made to lie on the ground, and who was suffocated by a knee placed to his carotid for 8 minutes and 46 seconds. Rayshard Brooks was a 27-year-old male who was shot in Baltimore, Maryland as well. Unfortunately, these heinous crimes have been taking place long before this year and were marked by the loss of individuals such as Trayvon Martin, Tamir Rice, Freddie Gray, and so many others. The societal distress, angst, and tension that characterized this year became somewhat of a call to action as it forced corporate settings, commercial settings, healthcare, and many different industries to revisit their diversity, inclusion, and equity initiatives, all in effort to address this national crisis. In spite of the seemingly evident history, context, and factors surrounding the Black Lives Matter movement and expression, there's almost always that response of all lives matter that follow. Several articles, videos, and other media sources have revealed that a large majority of Black people find all lives matters to be exclusive, dismissive, downright wrong, and offensive. And you may be wondering why. The reason for this is effectively captured in this analogy of a house burning down. The house burning down is equivalent to Black Lives Matter. By saying all lives matter, it means you're trying to throw water on all the other houses instead of just the one that's on fire. How would you feel if firefighters came to your neighborhood and began spraying water on every other house except yours, the one that's burning? The other houses don't need water right now, and all efforts, attention, and energy should be given to the one that is burning down. Thus, all lives matter is not a thing that includes Black people when they already know that they're left out. With Black Lives Matter, it is not to say that your house isn't important as well. Rather, it is to point out that our house is also important, that Black lives matter too. I would be remiss if I did not acknowledge that the push for equality and justice for African Americans did not happen in a silo, but actually took place along civil rights movements for many other minority groups. For example, the Latin American Civil War dates as far back as the early 1900s and was characterized by efforts to restore land grants, farm worker rights, enhance education, and provide voting and political rights. The Asian American Civil Rights Movement in the late 19th and 20th century started off as student-based and then progressed to a push for Pan-Asianism. The The Native American civil rights movement, which is perhaps the longest of them all, is marked by a long-standing fight to regain rights for the remaining tribes. However, for the purposes of this presentation, I will focus more on the African American plight as a marginalized group. As we proceed through the rest of this presentation, it is important to establish some working definitions. Starting off with diversity and inclusion. Diversity refers to the traits and characteristics that make people unique, whereas inclusion refers to the behaviors and social norms that ensure that people feel welcome. Simply put, diversity is who we are, which is like inviting someone to a school dance, whereas inclusion is what we do, making sure that they have access and the ability to get to the dance. Other important definitions are bias and privilege. Bias is the tendency to favor one group over another and can be conscious or unconscious. And privilege is a special right or advantage that is granted to a particular group or individual. Both bias and privilege will be unpacked further later in this presentation. And with that, it's time for our very first knowledge check. If you haven't yet already, or if you've joined the meeting recently, go ahead and text AdventHealth 065 to 22333, and I'll give you a couple of seconds to enter your response to this question, which is, what are the possible avenues through which systemic racism can manifest? Okay, let's take a look at the responses that have come in. And it looks like the overwhelming majority of individuals, or rather everybody, chose D. And in fact, D is correct. So as we mentioned, systemic racism can manifest in our education system, criminal justice system, and our healthcare system. So now let's move on to exploring diversity and inclusion in the workplace. Let's start by taking a look at minority representation here at AdventHealth. This data represents the entire AdventHealth system nationwide and shows that the largest minority representation is within the frontline team members. Just 31% of mid-level management are of minority background. And even lower, only 20% of executive level leaderships are of minority background. While AdventHealth does perform a bit better than benchmarks set by PricewaterhouseCoopers, a global leader for HR metrics across many industries, there is still room to improve diversity representation at all levels in order to better care for the diverse communities and patients that we serve. The importance of diversity and inclusion in the workplace is multifaceted and includes the ability to promote equality, equity, respect, and tolerance for persons of different races, ethnicities, creeds, religions, and backgrounds. To create safe spaces for differences to coexist and thrive as it relates to the mission, vision, and values of an organization. And then lastly, to enable businesses to achieve maximal results and output. As mentioned, diversity and inclusion initiatives work to create a safe space for differences to coexist. As we are all familiar with AdventHealth's service standards of keep me safe, love me, own it, and make it easy, every person, every time. These service standards align with our continuous need to encourage and promote diversity and inclusion at our institution. A lack of diversity and inclusion can impact the patients we serve in that it can prevent certain racial groups of patients from receiving the best care, as studies have shown that patients that receive care from providers of a similar background have better outcomes. Additionally, lack of diversity prevents organizations from indirectly teaching patients to be more accepting and tolerant of diverse providers from different backgrounds. AdventHealth service standards don't just apply to patients, however, it also applies to employees. Once again, every person, every time. Increased diversity and inclusion initiatives can improve talent acquisition, recruitment, employee engagement, satisfaction, and retention. Increased diversity and inclusion in the workplace enables businesses to achieve maximal results. McKinsey & Company is a US-based management consulting firm, and they've been examining diversity and inclusion in the workplace for several years. They generated a report in 2015 that examined proprietary data sets from more than 360 different companies in Canada, the US, the United Kingdom, and in Latin America. The report looked at metrics such as financial results and the composition of top management boards. And this is what they found. Companies that were in the top quartile for race and ethnic diversity were 35% more likely to have financial returns above their respective national medians. They then found that companies in the top quartile for gender diversity were 15% more likely to have financial returns above their respective national medians. And within the US specifically, they found that for every 10% increase in racial and ethnic diversity on the senior executive team, it corresponded to an earning before interest and tax rise by 0.8%. Shifting gears a little bit, the disparity of minority representation here at AdventHealth Central Florida Division's pharmacy departments is even more alarming. While frontline technicians and pharmacists report roughly 50% of minority representation, the disparity is greater within our leadership team. Minority representation makes up just 3% of our supervisors and 2% of our mid-level managers. And sadly, less than 1% of executive level director leadership. And this reveals that there's much work to be done within our departments and within the profession of pharmacy at large. In 2016, the Data USA revealed that only Caucasians had representation within pharmacy that was comparable to their proportion in the US population. Asian Americans were the only group that were overrepresented in pharmacy compared to their percentage in the United States. Meanwhile, all other minority groups, particularly African Americans, were underrepresented in pharmacy. To help improve diversity within College of Pharmacies, the Accreditation Council for Pharmacy Education, ACPE, released guidance in 2016 for schools to develop admission criteria, policies, and procedures to ensure that the selection of their student body was diverse. The results of this, unfortunately, won't be seen until this year's race and ethnicity data for pharmacists in the US are released to allow a full matriculation cycle from when this guidance was issued. For now, pharmacy programs located at historically Black colleges and universities represent a significant source of Black and African American pharmacists. Until other institutions are able to increase representation of underrepresented minorities, the Pharmacy Academy relies on HBCUs to increase levels of diversity and promote inclusion nationally. Pharmacy schools are not the only avenues, though, through which targeted diversity and inclusion efforts are being made within the profession of pharmacy. Pharmacy organizations began joining forces early this year, given the racial tension, social unrest, and upheaval surrounding the killings, of Black bodies by way of police brutality. On June 5th of this year, a joint statement was released demonstrating collective support for action against racism and inequity within the profession of pharmacy. APHA actually spearheaded a social media campaign with the hashtag Pharmacists Fighting Racism, which culminated in a day of recognition on June 26th of this year. Following the joint signing on June 5th, ACPE approved the creation of a Racial Diversity, Equity, and Inclusion Task Force. And just 2 weeks later following that, APHA announced their task force to address structural racism in pharmacy. More recently, NPHA, the National Pharmaceutical Association, launched a racial inequity webinar series to help spread awareness and to educate members and non-members alike. The objective of these created task force was to eliminate racism, discrimination, injustice, and marginalization of individuals within our profession, as well as within the communities that we serve. And targets to do this included assessing gaps and needs, conducting research, advocacy, developing professional development opportunities, as well as education and training. And this brings us to our second knowledge check, which is select the pharmacy organization that has not made efforts to address racial inequity within the profession at large. And I will give you a few seconds to log in your responses. Okay. And once again, you guys are good. Looks like majority of individuals chose D. And D is actually the correct answer, and this might have been tricky due to it being a negative question, as in saying not. In actuality, all three of those organizations, ACPE, MPHA, and APHA, have made efforts towards addressing racial inequity within our profession. And now let's move on to privilege. As mentioned at the start of this presentation, privilege is defined as an advantage or an immunity that is enjoyed by one societal group above all others. The issue is that privilege is often invisible to those that have it. It's merely there, a part of their world, a way of life, simply the way things are. And so this begs the question, if you don't know it exists, then how can you check yourself? Many people have never been asked or required to reflect on their own privilege status. And in regard to racial identity, doing so may actually feel uncomfortable. Privilege, however, is not a feature of just race. In fact, many other categories of individuals can benefit from privilege. For example, individuals perceived as attractive in our society have a certain privilege. Individuals who attain higher education, members of certain religious groups, individuals with wealth and power, as well as athletes. It is important to remember that there is a level of intersectionality with privilege. For example, just because an African American may be highly educated or an athlete and possess privilege in that way, it does not absolve them from being subject to racial discriminations and injustices. And a great example of this is Serena Williams, as pictured on the bottom of the screen, who, in spite of her athlete status, she still had to advocate for herself after giving birth to her daughter Olympia in 2018. The athlete tried to tell nurses after giving childbirth that she was not feeling well, she was experiencing pain in her legs, coughing, and that she needed a CT scan with contrast and IV heparin immediately. And this was given her past medical history of pulmonary embolisms. The nurses dismissed her assertions, believing that the pain medication was making her loopy. The physician eventually got involved and, after performing a CT scan, found several small blood clots in her legs. Thankfully, Serena was able to advocate for herself. But what about the many African American women that do not have the ability to do the same and die unnecessarily from birthing complications? Recalling our initial definition of privilege, white privilege is defined in the same exact way, except the group with that special advantage are Caucasian Americans. To be clear, white privilege is not suggesting that white people have never struggled or that their accomplishments are unearned. White privilege is simply a built-in advantage that confers special status to white Americans, potentially to the detriment of other minority groups. White privilege comes with a certain unspoken power that one can move through the world without race defining their interactions. The subconscious comfort of seeing the world that serves them as normal. Simply put, white privilege is knowing that you and your humanity are safe. As mentioned, privilege is based on affiliation to a group, not hard work. Unearned entitlements are restricted to certain groups because of the value of majority culture that influences political and social decisions. In this way, white privilege can and often does oppress certain groups. privilege holders experience exceeding deference, attention, and often get coddled. An example is not being able to have these types of conversation for fear that it will make white Americans feel uncomfortable. When it comes to recognizing white privilege, there are multiple avenues one can take in doing so. And Peggy McIntosh, for those that aren't familiar with her, she's actually an American feminist scholar and speaker who wrote an essay entitled White Privilege, Unpacking the Invisible Knapsack. And in that essay, she realized that while she had been taught about racism, along that same vein of thought, she was not taught to see one of its corollary aspects, which is white privilege, and how white privilege actually puts her at an advantage. If there are less individuals like Peggy McIntosh who are unwilling to increase their awareness, the awareness of their privilege, then unchecked privilege can have both subtle and overt implications in the workplace. Similar to bias, which we will explore in a moment, privilege can show itself in many ways, such as interrupting a person of color in a meeting, deeming an African American as unprofessional because they're wearing their natural hair out in corporate settings, giving harsher treatment towards misdeeds and misbehaviors of employees from minority backgrounds, and bypassing a person of color for a promotion in lieu of someone else from a majority background. All of these acts can prevent individuals from being their authentic self in the workplace. If we are truly encouraging a love me service standards and culture, then talking about these things are paramount. Privilege, as it relates to perceived discrimination stratified by race and socioeconomic status, was explored in a 2017 cross-sectional study. This study included over 99,000 respondents from an annual behavioral risk factor surveillance system survey fueled by the CDC. The study found that perceptions of racial privilege was less common among Blacks and Native Americans compared to their white counterparts. In whites, higher income and education contributed to increased perceptions of privileged treatment, as well as decreased perceptions of discrimination. And this pattern was actually reversed in Blacks, who reported more discrimination and less privilege at higher income and education levels. And across racial groups, respondents who reported foregone medical care due to cost being an issue had a higher risk of perceived racial discrimination. While a limitation of the study was that 90% of the respondents were white, the study still included 8% of African Americans, which accounts for more than 7,000 respondents. And the study was still able to show that socioeconomic status is an important social determinant of perceived privilege and perceived discrimination in healthcare. When individuals benefiting from privilege fail to acknowledge it, it can skew their personal interactions and judgments. Secondly, it can blind them to systemic barriers that exist for those who do not possess that certain privilege, thus perpetuating inequity. In order to check and recognize your privilege, you can start by asking yourself some of these self-reflective questions. For example, how diverse is the community in which you live? How do you feel when you are in a community that is different from your neighborhood? If you've recognized your privilege, what did you do with this realization? These self-reflection questions are included in the supplemental document attached to this meeting invite for your review. And that brings us to our third knowledge check, which is a true-false question. And it states, when privilege skews our personal interactions or blinds us to systemic barriers, it becomes problematic. I'll give you a few seconds to enter in your responses. Okay. And it looks like everyone chose A, which is true, and that is the correct answer. Moving on to unpacking bias. Let's first revisit the definition of bias. Bias is the tendency to favor one group over another. Bias can be conscious or unconscious. and it influences the way in which information is processed within our brains. It can actually lead to disparity in admissions, patient care, hiring and recruitment, promotion, and other opportunities for growth. Explicit bias refers to the attitudes and beliefs we have about a person or group on a conscious level. In this case, an individual with explicit bias is very clear about his or her feelings. And oftentimes, their related behavior is conducted with intent. Explicit bias is often categorized by overt negative behaviors. One notable historical example of explicit bias is the Tuskegee syphilis study, in which Black men were targeted to determine the effects of untreated latent syphilis. The study included 600 Black men, and it was conducted without informed consent being solicited from these individuals. The study was originally projected to last 6 months, but unfortunately lasted much longer. And in 1947, when penicillin became the drug of choice for syphilis, it was never offered to these subjects. It wasn't until 40 years later in 1972 when an advisory panel concluded that the Tuskegee syphilis study was unethical and unjust, thus stopping the study. The Tuskegee study demonstrates how conscious bias in this case, is manifested in the form of racism. And this has led to the unethical treatment of Black men that continues to have longstanding effects on health equity today. In fact, a lot of African Americans cite the Tuskegee study as the most recent example or stimulus for them having mistrust with our current healthcare system. Contrary to explicit bias, implicit bias operates outside of one's awareness. We all possess some form of unconscious bias within us, and a lot of it is due to centuries of unintentional conditioning, stereotyping regarding a particular race or ethnic group. Our brains simply love to recognize patterns and make sense of this complicated world. And so as a result, we often stereotype without even knowing it. Oftentimes, unconscious bias can be a direct contradiction to your declared beliefs and values. It is important to note that unconscious bias does not make you bad, it just makes you human. And what is important, however, is that we uncover our hidden biases. There are multiple examples of implicit bias. For example, crossing the street at night when you see an African American man walking in your direction on the same side of the street without even realizing why you're even crossing the street, and it is an example of unconscious bias that you may possess. This example can also be classified as what is known as a microaggression, which is actually a subtle, automatic, often nonverbal act or statement that reflects hostility and negative prejudicial views towards a group or individual. Another example of implicit bias is complimenting a Latino student for speaking perfect English when in actuality he's a native English speaker. A third example not mentioned on the screen would be what is known as shooter bias, and it is a tendency amongst police to shoot Black civilians more often than white civilians, even when they are unarmed. And we've seen this time and time again. Such bias is actually the bedrock for police brutality against African Americans today. As mentioned, implicit bias is often outside of one's awareness and can affect a person's behavior. It can and often does impact our behavior, and within healthcare, it particularly impacts racial and ethnic minorities as well as women. These groups are often subject to less accurate diagnoses, curtailed treatment options, less pain management, and worse clinical outcomes. Black children are often not treated as children at all and are not given the same level of compassion and care that their white counterparts are provided. Due to the fact that we all have implicit bias and are often at the mercy of this unconscious tendency to influence our actions or behaviors, Drs. Bananji and Greenwald actually developed a way to measure unconscious bias in the form of an implicit aptitude test. And this was developed in 1998. Multiple types exist, but the most popular and the most well-studied is the race IAT. The race IAT has been taken more than 4 million times between 2002 and 2017. And 75% of test takers demonstrated an automatic white preference, meaning that most people, including a small group of Black people, automatically associated white people with goodness and Black people with badness. IAT calculates how quickly people associate different terms with different racial backgrounds. Proponents of the IAT like the fact that it's a timed assessment, as it better shows how category pairs are unconsciously preferred. Meanwhile, others opposing the test actually feel that there's unclear evidence as to the degree to which the test predicts potential discriminatory behaviors. I have taken the IAT test myself, and as such, I will encourage all of you, those that are interested in uncovering implicit bias that you may possess, to go ahead and take it. The link is provided for you there on the screen, and it's also provided in the supplement documentation attached to this meeting invite. The usefulness of the IAT test was explored in a pre-post survey study conducted at The Ohio State University College of Medicine during their 2012 and 2013 admission cycle. To determine the presence and extent of unconscious racial bias in the admissions committee, they had members of the committee take the implicit aptitude test before the recruitment process, and that included reviewing of applications, interviewing, and then decision-making. And then they surveyed those individuals afterwards. And this study actually found that all groups, men, women, students, and faculty that sat on the admissions committee, all displayed significant levels of implicit white preference. The study also reported that 48% of the individuals that took the IAT were then that much more aware of their bias while interviewing candidates. Meanwhile, 21% of participants reported that having knowledge of their IAT results impacted their admission decisions. Astonishingly, the class that matriculated following this IAT exercise was the most diverse class in Ohio State University College of Medicine's history. And now this brings us to our fourth knowledge check, which does not require a response from you immediately. I want to give you a few seconds with all the information that you've received so far to just reflect on the types of implicit biases that you may possess. And what we'll do is at the end of this presentation, when we open up for questions, I'll also open it up for discussion so you can share some of your reflections. So just go ahead and take a few seconds just to think about this question. Okay, so that brings us to the last section of this presentation, which is what are some practical steps for uncovering bias? What are some next steps that we can take within improving diversity and inclusion? So first and foremost, to address bias, understand that unconscious bias is ubiquitous. We all have it. To uncover hidden bias within, one must first and foremost be willing to alter their behavior regardless of intent. One major point about unconscious bias is that it can be a direct contradiction to our professed beliefs and values. And so even though your intent may not be malicious, the impact of your actions or inactions can still be felt. Secondly, from an organization perspective, uncovering hidden bias is going to require a multidimensional approach in order to be the most effective and ultimately increase diversity, equity, and more importantly, inclusion. In the next few slides following this one, I will talk through some individual strategies, organization level strategies, and strategies that both individuals and organizations can implement to mitigate implicit bias. These strategies were developed from the work done by the Infectious Diseases Society of America, IDSA, whose specialty is uniquely tilted towards social justice by the very nature of the conditions they treat. Since 2016, IDSA has demonstrated a commitment to diversifying its society's leadership by commissioning the Gender Disparity Task Force, the Inclusion, Diversity, Access, and Equity Task Force as well. They've also reconfigured existing committees. They've developed new committees like the Leadership Development Committee, and they've created new opportunities within the IDSA Leadership Institute. These task force, which consist of adult and pediatric ID physicians, ID pharmacists, and ID fellows, were all committed to improving diversity, equity, and inclusion in their organizations and their respective professions. Moving forward, the slides with a color-coded letter in the top right corner will indicate if the strategy I am discussing is meant for the individual, the organization, or can be implemented by both. Starting off with the individual, bias can be addressed before or after it occurs. You have to be the example that you want to see in order to see change, and you need to address your personal biases ahead of time. So this includes unpacking whatever biases that you may hold within you. Don't be ashamed that you have certain discriminatory or prejudiced thoughts. Just be honest with yourself. And once you've established that, develop a systematic way to make decisions either in the workplace or in your personal life to ensure that you have concrete and transparent reasoning that are not hinged on your personal biases. Lastly, be open to new experiences to learn more about different ethnic and racial groups, as this will help create a new narrative within your mind and correct those pre-identified biases. And then shifting to the second half of the screen, or the lower half rather, let's say you're in an act or an exchange that is revealing your bias. What should you do then? First, it's important to remember that intent and impact are different, right? The absence of intent does not make the impact negligible or absolves it. You have to acknowledge that your actions were biased. Honesty goes a long way in fixing these slip-ups. As I mentioned earlier, unconscious bias does not make us bad, it makes us human. Finally, reach out and seek to always rebuild trust. Circling back to why systemic racism is so damaging and why ignoring it breeds mistrust within the African American community, it is crucial to constantly make efforts to rebuild centuries of mistrust, one act and one person at a time. Another strategy is a simple one, but it's effective, and that is to simply ask questions. As professionals and leaders, we are often taught the importance of soft skills all the time, and it is very much possible to be respectfully inquisitive. You can also take self-reflective personal bias surveys. You can host small group discussions amongst your colleagues and your friends. You can even form a book club to learn more about America's history, systemic racism, and bias. And I have some reading suggestions for you listed on the screen. And as with the other tools I provided, they're all listed in the supplemental document attached to this meeting invite. These are small behavioral changes that with time can help to retrain our brain to classify people as same instead of other. Previously, I talked about how one can address bias after it occurs, but now let's take a moment to talk through some strategies that the person on the receiving end of the bias interaction can do to counter and debunk stereotypes. First, acknowledge that bias is present and consciously make the decision to address it instead of letting it slide. For those of us that have been on the receiving end of a bias act or a microaggression, it becomes challenging over time when you've spent years being indirectly conditioned to accept such treatment. This is heavily seen in the African American community, where sometimes you don't even realize you're being stereotyped because you're so used to it. It becomes normal. To counter such biases and stereotypes, depending on your personality, you can use humor to diffuse the situation. You can reject the stereotype outright, ask poignant or rhetorical questions to make the other person rethink about what they just did in that exchange. You can acknowledge the discomfort that you yourself are feeling as the receiver of the bias act, or you can be direct and unpack the situation for what it is. The crucial piece here is that as a person that was on the receiving end of the bias act, endeavor to continue the conversation beyond the interaction. Shifting gears to strategies for organizations. Remember, diversity is who we are, inclusion is what we do. Leadership of an organization can commit to changing company culture regarding diversity and inclusion by hosting listen and learn sessions to stimulate open conversations periodically. You may or may not have heard, but our diversity, equity, and inclusion team here at AdventHealth has developed a new Inspire Inclusion module in ALN that launched on October 12th of this year. The module is 12 minutes long, and it's an interactive learning experience to allow team members to reflect on diversity, equity, and inclusion and what it means to them, as well as what role they play in pushing that agenda forward within the organization. Additionally, organizations can require hiring and recruiting committee members to take bias surveys, similar to what we saw in the Ohio State College of Medicine study. And this is simply to make the committee members self-aware during the process. And this can even be done on a department level with recruiting for residency or other positions. Organizations can also actively donate to local and national Black and minority communities, and they can openly highlight and celebrate national days and weeks. As touched on in the previous slide, organizations can commit to a culture training through computer-based learning activities that not only allow team members to self-reflect, but provides core education on what implicit bias is, what key terms like privilege and microaggressions mean, similar to how we've talked through those concepts within this presentation so far. Most importantly, organizations can make these trainings required annually, regardless if the person is a new hire or an individual that's staying on with the team. Both organizations and individuals can work to diversify their experiences to continuously counter stereotypes. Organizations can make intentional efforts to involve team members and employees from underrepresented groups and backgrounds, and to have them serve as speakers in major speaking events or conferences. Organizations can also partner with diverse schools like historically Black colleges and universities to develop pipelines for diverse talent as well. Along that same vein of thought, organizations and individuals can seek to create mentorship programs for career development and upward mobility, and also serve as sponsors for minority talent in recruitment or promotion meetings. And this brings us to our final knowledge check, which is a call to action. I want you all to take a couple seconds again to reflect this time on what are some diversity and inclusion initiatives that either our organization or our pharmacy departments can implement. And once again, feel free to take note of your reflections, and we'll discuss when we open up for questions. Okay, everyone take a deep breath. Indeed, we've touched on a lot of concepts throughout this presentation, all of which may make you feel uncomfortable or awkward, and that's okay. The goal of this presentation was not to point fingers, it was not to lay blame, but rather for each of us to gain a deeper understanding of the fact that systemic racism is real. Its effects are longstanding and they permeate all facets of our society, including the workplace. Privilege and bias must be confronted and discussed freely in safe spaces in order to fully uncover hidden biases, and also in order to affect real change. This topic does not stop here by any means. We have to be intentional and continuous in our push for diversity, equity, and inclusion. In order to change the narrative, we simply cannot relent. And with that, I'm going to conclude my presentation and open up for questions and for you to share any of your self-reflections. Thank you.